Well, welcome into Health Talk Mississippi, brought to you by the Mississippi State Department of Health. I am your host, Greg Flynn. Now, the goal of our podcast is to inform, educate, and yes, even entertain you about public health issues and things that you may think you know about and other things that you may go, I'm glad I know that now. Well, this month we are going to be covering breast cancer awareness. It is October. And so everything turns pink, even though everything's kind of orange with the pumpkin spice and everything. It's orange, but then it's also pink. That's what October has become known for and synonymous with. And joining us today is our director of our breast cancer and cervical cancer program, Miss Amy Gibbons. Welcome.
Thank you. Thank you. You can always paint your pumpkins pink.
You can paint your pumpkins pink. I've seen a lot of it. That's a growing trend, too.
It is. They have contests.
Well, this is like your Super Bowl month, isn't it?
It is. It's an exhausting month.
It's exhausting, but it's well worth it.
Very well worth it.
So if you can, just kind of give us a sense, an overview of what October means to you and why it's so important.
Well, the goal for the breast and cervical cancer program is early detection. And we know that early detection saves lives. So we do a lot of activities during October. We do a lot of wear pink every day or on Fridays. We take pictures. We'll have groups of women, men. Our biggest event that we do is our screening event. This will be our second annual one. Last year we did it. It was at the Trade Mart in one of the exhibit halls. And we had 2 mobile units that came in. One did mammograms, the Baptist mammography unit, and Plan A came in and did cervical paps. So that was a good event. We met our screening goals, and we're doing it again this year. October is really about screenings, getting those screening rates up. And we do a memory wall there at MSDH for those that have a diagnosis of breast cancer. And then we do an in memorial for those that are no longer with us.
So it's just a general awareness. It's really raising the red flag, or the pink flag, I should say, in October. Just everybody needs to be aware of it, whether you need to be screened or whether you need, some help in coping and dealing with breast cancer, cancer in general, really, and being able to remember those that fought valiantly and eventually succumbed to the disease.
Correct. And as you know, one of the things that our communications department does is our education awareness campaign. That's about every 3 days. There's something on the MSDH website and would be on the app as well that people can go to learn more about these cancers, and it'll have a list of our providers statewide, and then they can get a lot of information from the Centers for Disease Control that has a lot of data specific for Mississippi.
How have you seen this grow? Because it seems like, October has really bubbled. It's really doubled in size, then tripled in size. That, from when we first started out to where we are currently, how have you seen that grow, the support?
It really has. You hate to say it's taken off, but I think the prevalence of breast cancer, and I think when people of some type of notoriety are diagnosed, they talk about it more. I can remember being a kid, and so my mom's friends way back, that you just didn't discuss it. And now it's something that's talked about at dinner parties or just at dinner in general, and friends get together. There's even groups of women that'll spend the day, rent a limo or a van, and they all go together to go get their mammograms. So it's definitely more talked about and more open. And that would contribute to the rise in the diagnosis just because people are more aware of it. But there's still a lot that are not, or that don't go get their screenings, and that's who we target.
It's heartwarming to see when it goes, especially in athletics these days, because whether you're going to a high school football game or you're watching the college and NFL and all these big bruising guys, and they're willing to wear pink on their wristbands, on their everywhere.
It is, and we were fortunate that we were able to purchase some pink pom-poms, and we went to 4 local high school games, and we were invited to go to Jackson State's pink out game as well to pass out those pom-poms. And in going to a lot of the schools, you see the kids on the field that are athletes who have lost a mom or an aunt or a grandmother to breast cancer. And so I think it's really good to engage our males in talking about it. So it's not just such a stigma where you can't talk about it. I talk openly about it with, our son and my husband and other people. So I think that does help a lot. It gets that name out there.
You talked about it's less of a stigma that people can talk about it. One of the things that we had Dr. Edney on a couple of podcasts ago, and he talked about it's hard to get men to go to the doctor. It's hard to get men to go get checked, for preventable things if they catch it early. Do you find that women are more apt to go see their doctor or to do the checks themselves?
Well, self-breast exams are very important, and we do encourage it. But with our program, it's more about screening, getting those early detected screenings, because that's what saves lives. It depends. Our program targets those women that are uninsured or underinsured. So if you don't know about our program and maybe you feel a lump or you have a history in your family of breast cancer and you have to decide between paying bills, putting food on the table, do I want to know if I have this? Because if I do have a breast cancer, what is it going to cost? So our program, we reimburse our enrolling providers in the state for women to go in and have those free mammograms. So we still have some people that just don't want to know or just don't want to go for whatever reason. And that's who we really try to target and reach out to.
What do you see the apprehension being, in talking to people sometimes? Like, oh, well, you should, I always thought about it, but then I finally did.
A lot of it has to do with fear. It's the fear of knowing, what if I have this, then what is my life going to look like? What is my family's life going to look like? Also, you take our Delta population. That's the area that we really try to focus on as well, is because it's very, very rural. Mississippi is a very rural state. People have transportation issues. We see healthcare, hospitals closing. And so there's a lack of doctors. So somebody has to travel far away to even go get the test. Then they've got to go back for follow-up, and people they can't do it. And also we've been told that when you live in a small community and there is a healthcare center there, whether it's a health department clinic or a hospital, they know who works there, and people don't want their business out there. So that can be a problem too. So we really work to try to get those targeted women to the right location and what's going to be a good fit for them.
Well, I'm sure you've got some great success stories too of listening to women that did come into the program and it did get found and it did get taken care of probably before it got worse.
Yes, and even at our screening event, I will tell you, we had a lady that came in. She had been employed for about 30 years with insurance. She was in our age range, and she never went and got a mammogram, and she lost her job. And so she was just doing, full-time contract type, by the hour. And her daughter was encouraging her. She was really worried. And so we waited for her for the event. She came and we talked with her afterwards, and she just cried. She said, I just did not know that I could get on a mobile unit, like that you order pizza, or the ice cream truck that looks like, to come get this done. And, luckily for her, it all worked out good. But, if she's unemployed this year and she can get registered, we would love to have her back as any woman like that. So, yeah.
Well, it really does affect anyone at all ages, because your program officially is between ages of 21 to 64. Correct. That's correct. I bet it's probably harder to get the young people to realize that they need to be screened as well. Do you see that? Is there a difference between the ages of people wanting to get screened?
Sometimes, and it can be. We do have, ironically enough, the past probably 6 to 8 months, I can give approval for those women under 21, and we have really had a number of women that are 18 and 19 that have we approved, they have a lump and they're going in for all that screening. So it's a lot of times women wait. We want to just think that it's not. And then when you're in childbearing years, you think, I'm running around, maybe it's too much caffeine, maybe I'm just tired, and don't really think of that as being very necessary, because when you're young, you just don't think anything's going to happen. And so it can be that middle-aged to older women that do take it more seriously, especially if there's a history. If you have a history in your family of breast cancer, it is very important to get seen.
Well, and the wonderful part, it sounds that you have such great partners around the state with the providers. So, take us kind of through the steps that it's not just screening and says, oh, I have something. Well, then that sets off a new chain of events where you're going to help get them along the path.
Correct. So the way our program works is that we have enrolling providers, and you have to be enrolled in BCCP, and you have to go through an enrolling provider. So the MSDH clinics, they're enrolling providers. So we have those clinics all over the state. And then we have a lot of the major hospitals. There's radiologists, different clinics. We have the FQHCs. So if a woman feels that she needs to have this, she can go to one of our enrolling providers, and that, of course, is on our website, to check the area that they live in and to get screened and then get enrolled. And once enrolled, they will go through all those steps of getting their mammogram. If a woman does have breast cancer, then our nurses, the BCCP nurses, are able to get them enrolled into Medicaid. Typically, Medicaid takes about 45 days to get your Medicaid, and we have a partnership with Medicaid. They can do expedited Medicaid, so they can get them enrolled for in about 7 days, because nobody needs to wait 45 days if you have a diagnosis. And so then Medicaid would pick that up for the woman. But, we do have our one thing that we do have is patient navigation. Our enrolling providers, they do follow up with those women to make sure that they've made it to that appointment. If that appointment changes, they will help them with that. And then just to find out what their diagnostic resolution is, and really just to support and encourage them.
Well, it's heartening to know that there's somebody there for women that may feel lost. And it sounds like this is the best way for them to, take that stigma off.
Well, it's a determination. So they would have to determine, one of the things they're going to ask is, do you have a history of breast cancer? Is there a history of breast cancer in your family? So there's several other things that they have to go through in order to be screened and then be enrolled in the program.
And this is really primarily for the uninsured, underinsured.
Correct.
Right?
Correct.
You just hope that everybody else that's insured is also taking the same kind of steps as well.
Absolutely. Take advantage of that insurance for sure.
You just realize how staggering the numbers are that, the latest numbers say that, close to 2,000 people in Mississippi a year are diagnosed with some form of a cancer. And, I would imagine that breast cancer is one of the most prevalent.
It is. We enrolled, we had about a little over 3,000 women each year. That's kind of our target. Of course, we want that to grow. And, you have to look at those reasons, disparities as to why women don't get there. One of the things that is happening more in Mississippi, which we're very proud of, and is the mobile units. Mobile units are just taking off. And that mobile unit can get to those women. They can set up a screening event in a certain town, and they're getting the women. So it's bringing it to them instead of them having to go seek it out.
Yeah, you go to where the people are, right?
That's right.
We're trying to take away every excuse from people, right?
That's right.
About why they don't get seen or why they don't want to get checked up or find things early. We're really taking that away from people.
Absolutely. And there's a lot of population that we don't think about that doesn't receive health care, such as our unhoused population, and those in shelters and domestic violence shelters. So we really try to do a lot of outreach in those areas as well to capture those women.
When you talk about the disparities, I know that was something that is near and dear to your heart, to erasing those disparities. Tell us a little bit more about that.
Well, that's the fear of going. That's the that stigma, just not wanting to know, not being able to have transportation to get there, trying to figure out, do I want to know? And if so, what happens then? And then there being a lack of resources in certain areas. We've had someone call that received a diagnosis, and in order for more testing and things like that, they were going to have to drive 3 hours each time because there was no resource, in that area. So we worked to try to find a provider that they were comfortable with in their area, and luckily that worked out.
I'm shocked by the statistic that we have on our website under your section there, that more than a quarter of Mississippi's women do not receive regular screening that could save their life.
Right.
That's staggering.
It is. And I just think it's that fear. I mean, as a woman, it's very uncomfortable to go have a mammogram. It's not something that, you wake up and you're just so excited to go get it done, but it is necessary. And we know that early detection is what saves lives. I have family members that discovered it very, very early, had a symptom that they ignored, and we encouraged her to go get it done. And she was stage 1 and has gone through a double mastectomy and reconstruction and is doing well. But she just chalked it off as, we don't have it in our family. It's okay. But it wasn't.
Well, and you look at the risk factors here for women. African American women are more likely than all other women to die from breast cancer.
Yes.
Their tumors are often found at a later, more advanced stage when treatment is less effective. That goes directly back to the early screening, right?
Correct. And just not wanting to know, not going, having a lack of resources. And, we don't know why our African American women have higher rates of breast and cervical cancers.
It says here older women are at a higher risk, especially those over 50.
Correct. We wait. I'm in that category. So we put it off. We don't think it can happen to us, and it's something I'll do later.
This is one that's probably, they call us I don't know if we're still the most overweight state. I think we keep going back and forth, that we keep coming off the bottom by just a pound or two, I think. But being overweight increases the risk of breast cancer after menopause, especially.
It does. Being overweight, smoking, lifestyle choices. So all of those things, eating right and taking care of yourself. And look, we know that people that, ride their bike 1,000 miles a week and things, it could happen. We know that. But it is trying to take away some of those factors that do factor in to contribute to that cause.
And it seems like the age 40, you mentioned here, women ages 40 and older should be routinely screened just when you start hitting that age.
Right. Go in for your yearly mammogram.
It's kind of like they've kicked the age back for getting your colonoscopy done, where it used to be 50, and then now they say, oh, well, by 45, you should be going to get your first one. So if nothing else, do you recommend that the women, if you haven't yet, but by the time you're 40, you really should be?
Of course. I mean, I think like along that with colon cancer, I think when you start seeing younger and younger people with a diagnosis, it's like, okay, maybe we do need to kick it back. And I think that's the same for breast as well. We are seeing younger in their late 20s, in their 30s. And especially if there's that family history, if you've got grandmother, mother, with a breast cancer diagnosis, then those women need to be screened early and often as well.
Well, when you look at the risk factors, you just mentioned the number one is know your family history, maintain a healthy weight, limit alcohol intake. That's an odd one.
Yeah, alcohol can cause a lot of problems. That it can not good problems.
Yeah.
It can cause some problems for a myriad of things. So I think it's just that healthy lifestyle. I read a lot about how alcohol enters our body and affects our body in ways that we don't understand. So I think alleviating alcohol, or just, tone it down some, and of course not smoking.
Yeah, quit smoking, tobacco use, another big one. Breastfeeding, if you can. It says there for mothers.
Right. Breastfeeding is really good. Not all women can breastfeed, and that's okay. But if you are able to breastfeed, do breastfeed your child. There's just something about that does help decrease that breast cancer.
We had just some of the things that people can immediately make a quick checklist for is, you have here, know what is normal for you. See your doctor if you notice changes in your breast. And it lists list here of symptoms: lumps, hard or thick knots, swelling, redness, and darkening, unusual changes in size or shape, dimpling of the skin or pulling in of the nipple, itchy, scaly, sore, or rash. Certainly discharge would be definitely a red flag.
Yes, and I will say, women that do drink, we've heard drink caffeine and things, they do tend to get different lumps and stuff like that. But they get, you get that checked for sure. But self-breast exam is important, and it's important to look at your breast for those reasons. If you notice something, a change, where maybe one side's sagging, or you've got a swelling, and the nipple, of course. I know that's not a topic everybody likes to talk about, but I will throw this in with my family member. She noticed some itching of her nipple and just thought maybe it was my detergent, and it went on for about 2 months, and that's what it was. And I've heard several incidences of issues with the nipple and the dry, itching, changing color. It can become inverted, and that's where it starts.
Yeah, I mean, it's one of those things that, back in the day, everybody would blush if you talked about those kind of things, but they're really lifesavers now.
It is, and I think that's what's really good about it. It really demotes the stigma of breast cancer, and I think a lot of cancers, because people are talking about it more. I mean, you think about prostate cancer, colon cancer. Those were just not cancers that were talked about. Not when I was growing up.
Well, nothing was ever really, everything was kind of like taboo, right?
That's right.
And we relied upon the schools to teach in health class.
Right.
But you say that conversation needs to start at home.
It does. I think moms and their daughters need to talk about it. And I think it's very important for moms to share their history, not with just their daughters, but their sons. But if we're just focusing on breast cancer, definitely talk about it. My mom talked about it with my sister and I. And I think, and my aunts, we talk about it, and girlfriends. So I think it is a conversation that needs to start at home to know your breast. Now, if you're 16, 18 years old, you don't want your mom checking your breast. But if you notice something, you should be able to go to a trusted person, your mom or someone, and let them know that, hey, something is going on. It's very rare, but there are cancers in people under the age of 21.
And one of the things you can't forget that may be rare, but it is certainly possible, that men experience can have breast cancer too. I was floored to learn that a couple of years ago.
Absolutely. And can have a lot of the same symptoms. Noticing the change in their breast tissue, a lump, changes with their nipples. So our program, our funding, it pays for women. We don't pay for men at this time. So that's a CDC thing. But
you certainly got to make sure you get checked. I mean, whether you're, again, swallow your pride, especially if you're a guy, if something ain't right, go to your doctor.
And men should encourage the women in their lives to do that. I think that is important as well for sons and daughters to see, the men in their life encouraging that mother or grandmother to go get it done. Like, look, take a day. This is a priority.
It is, and I think that October is certainly what does that in helping with this awareness.
Correct.
It just gets exciting. I mean, October is big. You just think of the orange, but then now when October comes around, you all have done such a great job, both locally and nationally, of making pink the secondary color of October.
Absolutely. And then comes January for cervical, which is teal. But breast does get a lot more emphasis put on it. And I do encourage people to visit the website in October for this month to look at all the health education and the awareness that MSDH puts out for us.
Well, and you have to, you talked about January is when cervical cancer, and, you know, cancer is year round. I mean, cancer doesn't stop, for the calendar. You know, what is it that you want people to know, just in women's health in general, because that's what you guys really focus on over there, the importance of screenings for all different kinds of cancer?
To not be afraid. Deal with it head on. You got to face it. You've got to go ahead and deal with it. And I know that that's very scary. There's things in my life I don't want to face or deal with head on. But I think that that's very important, is that women and men too should, know their bodies. And if something just doesn't feel right, you've got to go get that seen about. And I think the biggest thing is to know that there is a program out there that if you do not have insurance or you have very minimal insurance, there is a program that will pay for you to get a mammogram and a cervical screening.
And it's uncertain times. I mean, for people, especially with a lot of healthcare coverage, as we see, whatever is going to be happening with Medicaid,
Correct.
And we don't know how many people are going to be on Medicaid, off Medicaid. That this is truly a lifeline that they should take advantage of.
Yes, sir. It is.
Well, it's October, so when you mix in your pumpkin spice, you got to mix something a little pink in there
Throw
too,
in
right?
a little pink.
Just remember, it's October. Wear pink. Certainly on Fridays, right? Is that what you said?
Absolutely.
But you can wear pink every day.
You sure can. Some of us do a lot.
Just in general, but for the whole month of October, you can wear pink.
Wear pink.
Guess that may change a little bit when you get up close to October, but we'll be on the lookout to a Halloween. Sometimes you get your Halloween costumes, but we'll be on the lookout for your pink pom-poms.
Oh, yeah. That's always a fun thing.
Do you look forward to when you walk? What is it like when you did that for the first time, or when you did it last year and you walk in and you see a stadium full of pink pom-poms?
It was incredible. So one of our nurses, she lives in Brandon as well as I do. So we were fortunate. We were Brandon High School was chosen, and if you've been to Brandon High School, the stadium is just phenomenally good. And she and I were standing there just before halftime, and to look down and see all the pink, it was just, we both just had chills, and we just hugged each other. We were like, it was worth it. It was worth it. So
as long as everybody remembers the meaning behind the pink,
correct.
Right? It's all fun to wear pink and wear your shirts and dresses and stuff on Fridays, but remember the reason why you're wearing it, right?
Absolutely. It is. And, around Mississippi, I think administrators, they're very encouraging. When you have teachers and staff that have a breast cancer diagnosis. So I don't remember in school here in Jackson doing all of this. I just don't remember it. And so I think that it is just incredible. It's just remarkable that the schools are really putting it out there and to discuss it. They announced our program multiple times from the press box. And so it gets that word out there for sure.
Well, God bless you for everything you guys are doing. You really are saving lives. That is undoubtable for sure. That is Amy Gibbons, our breast cancer and cervical cancer program director. And that is going to do it for this edition of Health Talk Mississippi. We will talk to you again soon. Remember, wear your pink in October. I'm Greg Flynn. We'll talk to you again on Health Talk Mississippi.